Broadcast is now starting. All attendees are in listen-only mode.
Good morning, everybody. We are going to wait a couple more minutes to let everybody else join, and then we will get started. Good afternoon, everyone. Thank you for joining. My name is Mary Myers. I'm the Director of Business Development at the Lake Superior Community Partnership. Welcome to today's webinar, Tips for the Restart of Business. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You're listening in using your computer's speaker system by default. If you would prefer to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenters by typing your questions into the question pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of today's presentation. I would now like to introduce Amy Clickner, the CEO of the Lake Superior Community Partnership. Amy has been at the partnership for 22 years. She is a certified economic developer through the International Economic Development Council, where she currently serves on the board of directors along with their external relations and governance committees. Amy is a certified fundraising manager, past president of the Michigan Economic Developers Association, past chair of Economic Development Research Partners, and past chair of the Northern Michigan Chamber Alliance. Today, Amy will be touching on the LSCP Business Restart Toolkit and on how businesses can strategically think about reopening.
Good morning, everyone. Next slide, Emily. Thank you all for joining, and I'm really excited about today's lineup. We've got some great subject matter experts to talk with you. So I'm going to go through my stuff rather quickly so we can get to the more important part of the session today. But I'm just really happy that we are talking about reopening and restarting, coming through what we've been through in the stay at home and businesses shut down and concerns about health and safety and economy. I kind of feel like maybe we're seeing some light at the end of the tunnel and we can start planning and prepping for doing that well. Just a reminder, the Lake Superior Community Partnership, we're a public-private partnership. We've been in business for about 23 years now. We provide business development services to all startup through succession, all sizes and all sectors of businesses. We also work in the talent space, marketing, networking events, leadership development through our Leadership Academy, and provide data and research for business and organizations such as economic impact studies, wage studies, and the like. Next slide. Make sure you are constantly taking a look at our website, marquette.org. We have done a really great job, the staff has, of keeping the resource page for COVID-19 up to date. And that's where you will see a lot of the things that I'm going to be talking about today on that page. Next. Some of the things that we've worked to develop to have you thinking about what to do when this happened, while this was happening, as we come out of it. We created a crisis checklist, and again, these are all downloadable on our website. And this is a lot of what you should be thinking about as a crisis begins, and where you can work to help save your cash flow, those types of tips. Next. We also then worked to create a hibernation toolkit as some of the businesses went more in a lockdown mode. This is just a great way to how you should react, what you should be doing to hit the pause button if that's what you chose to do or needed to do in your business. Next. We also then worked on a resiliency toolkit, and a lot of these toolkits we actually worked on too with colleagues in Great Falls, Montana Economic Development. A good friend of mine there and a great staff. We were able to develop some of these pieces jointly. And again, this is one that is just saying, hey, you know, how do you make some adjustments? How do you think innovative and creative to be resilient during this difficult time? And what should you be looking at for your customers and clients? Next. We recently launched a reopen preparedness. We weren't sure what the governor was exactly going to announce last Friday about which businesses would be able to start opening, but we wanted to at least get businesses and organizations thinking about some of the things that they can be doing now and to take some control over the situation. You know, what can you do to prepare? What actions can you take that will put you a step ahead when your doors can be opened again? Next. And of course, today's webinar is part of the launch for our Restart Toolkit, which again is on marquette.org. And some businesses are able to do curbside delivery, curbside and delivery. Some are being able to be open with certain guidelines. This toolkit does a great job of walking you through what you should be thinking about, what you should be doing, anything from regulations to safety, and managing those phased-in stages of opening. It does have a lot of templates and links that can help you customize what you need, and it also gets into industry-specific type of requirements that you may be needed to manage while you're going through this process. What's really great about today's webinar is it kind of takes this document and makes it live with the experts that'll be talking in the different areas, and then also allowing you to engage in question and answer. Next. So in the kit, it talks a lot about regulatory work, making sure that you have the safety, but not just the safety in your workplace. You want to instill confidence in your employees and your customers and clients and patients when they come back through your doors. So it's not just about doing the hygiene and the safety, it's about mentally preparing folks to feel comfortable in your space. Of course, marketing promotion, you need to pivot a lot with that. We're going to talk about that today. Human resources and management, we'll be talking about, you know, how do you onboard those that you may have laid off? What does that look like? What do you as an employer need to worry about or be able to protect yourself? The report also talks about financial and reporting and making sure that you're doing health checks financially on your business, because whatever your budgets look like and your business plan starting at 2020, you might as well rip them up right now because they're not going to be the same. So we want to make sure that we're being financially sound and realistic in what our expectations are for revenue and expenses. And as I mentioned, we did get into some industry specifics because depending on what industry you're in, there is a whole different type of requirement. For example, for a retail shop versus a restaurant. Next. And of course, if you need assistance, we've been working remotely through this whole time. There's contact information here for our staff, whether you need business development services or marketing support. We're here to help you every step of the way. It's not the time to go it alone. You have a team and you have a lot of others that are here. We talk about it as our bail team. You should be relying on and leveraging your banker, your accountant, your insurance provider, your lawyer. They're all here to help you, just as your economic development organization is. And it's a time to leverage all those resources to make your reopening and your success happen. Next. So we're going to do questions at the end, but again, I want to remind you that all of this information and then also the recording of this webinar will be on marquette.org on our COVID-19 page. And I'm going to move it forward because I am just as excited to hear our other speakers as you all are. Thank you for joining in today.
Thanks, Amy. As Amy mentioned, the role of the LSCP is to help businesses and organizations prepare to reopen properly and be successful. So one thing is we will also be launching a Love on Local to play a role in the recovery of local businesses. So that'll be coming too. Next, we welcome Dr. Jennifer Dehlin, the co-owner of Singletrack Health, a family medicine clinic in downtown Marquette. Dr. Dehlin is from Houghton, where she went to MTU for her undergrad in biomedical engineering. She then went on to U of M, where she earned her medical degree in 2005. In 2005, she returned to the Upper Peninsula and has been a resident of Marquette since. Today, Dr. Dehlin will be speaking on the reason we all are here, COVID itself and health and hygiene. Thanks for being here, Dr. Dehlin.
Good morning. Thanks for having me. As she said, I am a Marquette resident. I've lived here since 2005 with my husband, Chris, and my kids, Sam and Stella. Next. And my focus today is on preventing the spread of infection in our businesses. And the reason I wanted to participate today is I just recognized how difficult it's been for us with our business to try to change and adapt to be able to do the things that we need to do safely. And both my husband and I, the owners of our business, we have medical degrees, and it was complicated for us, and it continues to be complicated for us. And so I felt like I wanted to try to share the best I could. And like Emily said, this is definitely a time that we all need a team, and we have been in contact with our other team members, insurance, HR, everything to try to make this work. Next. So we all have the same goals here. We want to keep our employees and our customers safe. We also care about our communities and want to be protecting the vulnerable in our communities, and we do that by preventing spread. And of course, all of us also want to be able to keep our businesses open and to keep our employees on our payrolls. And certainly nobody wants to be a place in our community where the disease is spreading. Next. So the one thing that I want to really emphasize from my presentation is just how this disease spreads. So this disease primarily spreads through respiratory droplets. So the virus lives in the secretions that come out of our noses and mouths, and it spreads to another person when that substance gets in another person. And so the primary way that happens is when somebody who has the virus in their secretions is close by another person and they're coughing and sneezing, droplets are coming out of their body and entering another person. And so I'm going to talk about ways to try to keep that from happening. Next. There's a lot of terminology involved in this whole thing. So COVID-19 is actually the disease that's caused by the virus. The virus itself goes by a number of names. A lot of people call it the novel coronavirus. Coronaviruses are actually a family of viruses, and so other coronaviruses cause common colds that haven't disrupted our entire world. There have also been some other coronaviruses similar to the one we're dealing with now that have caused outbreaks in other parts of the world. I don't know if people remember those. That would have been like SARS and MERS. And for reasons that epidemiologists and virologists understand, those didn't turn into a complete disaster like this one does. So again, this started in Wuhan, China in 2019, but because of some characteristics about the virus, how it spreads and how it spreads through asymptomatic carriers, it went global faster than anything we've dealt with recently. The primary disease that it caused, it's a respiratory illness, and so it would feel like influenza feels, where there's cough, there's fever, shortness of breath, chills, headache, muscle pain. Interestingly, whereas influenza comes on very abruptly, people will come into my office and say, oh my gosh, at 1 o'clock, I got sick. You know, you're looking for the truck that ran over you. With this virus, there is a little bit more of a prodrome, meaning that the initial stage, people are not very symptomatic. And that's hard because then those people actually have the virus in them and they can be spreading it and they don't feel that bad. One thing that's kind of unique to this virus is that in some people, it causes the loss of taste and or smell. And so that's kind of a unique feature that we should all look out for. There's two basic types of testing available for this virus. There is testing that tells you if you have the virus right now in your respiratory secretions. We use a long swab and we put it in your nose, straight back a couple inches until the swab touches your throat. Very unpleasant. And then that looks for basically the virus itself in your secretions. And again, you could obtain that sample for somebody with symptoms or somebody without symptoms. And you're going to have the virus in those secretions for a period of time. And then as you recover, that virus is going to come out of those secretions. So it doesn't tell you if you had the virus, you know, a month ago or 2 months ago. For that, there's something different. It's a blood test. We call it serology. And we're looking for basically the immune response that your body makes in response to a virus. Right now, the testing that's available in our community looks for something called IgG, which tells us about past immunity. So if we've been testing some people who say, you know, okay, 6 weeks ago, I had travel, I had possible exposure, I really think I had it, you know, can I have the test to see if I had it? And so from a blood sample, those right now get processed through UP Health Systems Marquette and get sent to the lab at Mayo. And within a couple days, we can tell you whether that was the case or not. Unfortunately, the thing that we can't tell you is what that means. We can't infer the presence of these antibodies to mean that the person is immune. A lot of people wish that was the case, but as more data is coming out, we're learning that that's probably not, that having it once does not mean that you couldn't have it again, although that type of information is going to be evolving. Next. Because the information is evolving so fast, I'm trying to stay up to date by looking at a couple core websites. I try to stay away from the kind of standard press, things that might be sensationalized, and instead I'm trying to focus on what the CDC, World Health Organization, and the Michigan Department of Health and Human Services are putting out. Next. One of the things that I look at every day is just the coronavirus cases in Michigan. This is the cumulative cases. And if you look at the red line, you can see that initially we were adding cases exponentially, and that was through about the first week of April. And then in the last few weeks, it's been basically linear. So we're adding about the same number of cases every day. And that's again been the case since the beginning of April. Next. The thing that I wish I had was a crystal ball, because we've been adding cases in a linear fashion with our whole state on a pretty tight lockdown. What we don't know is what's going to happen when we take some of those restrictions away. There's a number of kind of popular predictive model websites. And for the most part, it's like reading tea leaves, and we really just don't know. You know, this shows 3 potential curves. One, the pink one, is really horrible, and that's that's hypothesizing if we all went back to hugs and kisses and bouncy houses and other things. And then the lowest teal line, which you can barely see, is if we stayed on lockdown mode. And then really what's probably going to happen is something in the middle. And the something in the middle is what we're trying to impact. We're trying to move forward with doing more business, but keeping the disease incidence low. Next. In my opinion, the best way to not transmit disease in conjunction with your business is to keep people out of your business. So that, to me, means keeping employees out of our business by, when it's appropriate, continuing to have some people do remote work, only having them come to the office if really they have a job that requires it. At our office, we're also looking at staggering employees' shifts and extending our hours to try to minimize the number of employees that are in our business at one time. The other thing that I think we all need to think about is how do we limit the customers coming into our business, especially if our business is really small. Some of the gift shops, things like that are very tiny. And so, if we can keep people curbside or delivery or just spreading out the frequency that people come in, I think that that's important. And also keeping non-essential foot traffic out of our business. So, if they don't need to come in our four walls, they probably shouldn't. Next. And really, we need to keep sick people out of our businesses, because whereas an asymptomatic person has some amount of virus in their droplets, a person that is actively sick has more virus and they are also spewing it. So I think that looking at employee sick policies is something that's going to be very important. And this also might require a cultural change at some of our businesses. In some places I've worked over the years, it's kind of a badge of pride or something like, I never miss work. Well, we really can't be coming to work when we're sick right now. And then I think that we should have some type of screening for our employees, whether it's something formal or self-screening. And that should be really done before they walk in the door. So if they have any signs of sickness, that we're keeping them from coming to work. It would also be ideal if we could keep sick customers out. The way we're doing that in our practice is by seeing sick patients either via telehealth or in their vehicles out in the parking lot to minimize the ability for them to spread it to our employees. For other businesses, I'm just not sure how that would go. I know that we tried to do some signage early on in this to try to keep people who are sick out of our building, and it didn't work at all. Next. If we can't keep people out of our businesses, then the attention turns to putting barriers between workstations and redesigning the workflows so that we're maintaining social distancing. And then also, obviously, cleaning and disinfecting. The highest risk thing is droplets going straight from one person to another, but droplets can go from a person to a thing to another person, and that's where the cleaning and disinfecting come in. Unfortunately, we don't know a lot about how long the virus lives on different surfaces, so we just have to probably overdo it. And for employees, they're going to need the time and the supplies to be cleaning their workstations regularly. And for customers, ideally, they would be able to clean themselves, at least some hand gel for their hands when they enter and exit some of the businesses. And then also having availability of them to be able to do some cleaning of things like cart handles or other shared items, or even disposable gloves that they would wear within the business and then could be disposed of on the way out. Next. Employee protective gear is going to depend a lot on the type of business. For most businesses, we would be looking at cloth masks, not the surgical masks or N95s those are designed to prevent both droplets and aerosolization. Aerosols are, you can think of it like a fine mist. That type of thing does not really get created in most interactions. Employees need to know how to wear and don and doff the masks. There's good videos for that on the CDC website. It's also helpful to have people wearing a goggle or some type of face shield, because it avoids this and it helps them stop touching their eyes. People touch their eyes all the time, but if you have goggles or a face shield on, you don't do it. And then consideration for employees using disposable gloves as well. Next. So just back to my punchline, really the core of this is avoiding spread by respiratory droplets, so keeping people apart. I think that should be our focus, is avoiding that interaction. Once you bring somebody in your business, it just gets very complicated to think about how to separate people and barriers and masking and goggles and all of that stuff. If they never come in, then you don't have to deal with any of that. That's the end. Questions later.
Thank you, Dr. Dehlin. Some great information. I know with all the media out there, it can get overwhelming to follow what the virus actually is and how to avoid the spread of the virus in our business. So you gave a lot of good advice on potentially requiring face shields, disposable gloves, etc. Next, we welcome Laura Caters-Reilly, an attorney at Kendricks, Bordeaux, Keefe, Seavoy, and Larsen. Laura is a graduate of the University of Michigan and the University of Wisconsin Law School. She maintains licensure in Wisconsin as well as Michigan. Laura serves as a management representative on the board of the UP Labor Management Council and has been named a rising star in Michigan Super Lawyers. She has a general practice with an emphasis on management, side labor, and employment law, business law, real estate, and estate planning. Today, Laura will be speaking on employment law and the regulations businesses must follow. Thank you for being here, Laura.
I'm glad to be here. Next slide, please. Before I get started, I want to let you know that my presentation today is going to focus on bringing back reluctant employees. The employee who says he or she can't come back to work because he or she is afraid of getting COVID-19. And we're assuming, of course, that the employer needs this employee to come back. We're going to look at what the law requires, and I'm going to give you some advice on doing that. But before we get started, I want to make a couple of points. First, I want you to know that the law has a long memory here. There have been prior instances of pandemic type occurrences in the United States, and the law has responded to that. The very first one actually goes back to the 80s and the 90s, which would be the HIV/AIDS crisis. Try to think yourself back, those of you who are still alive then, to remember that in the early days, nobody really knew with certainty how it spread. There were all kinds of lawsuits and litigation about discrimination and claims. Think about the movie Philadelphia with Tom Hanks in it. I mean, those are the kinds of ways that the legal system responded. More recently, there was the SARS birds flu epidemic, mostly on the West Coast and in Asia, and the law responded there too. So the law has prior examples of employers and employees trying to work within pandemics and with some uncertainty on how these things spread. And when this calms down, months or maybe years from now, if you get employment claims, you're going to be judged based on what we know from prior instances in the law on how much you relied on the best knowledge we had at the time for how the disease spreads. This is really not the time to go with your gut, go with what you're reading on Facebook, go with what some news anchor says on some news channel. This is the time to focus on getting the right medical guidance so you understand how the virus spreads, like described by Dr. Dehlin, and getting the right medical guidance from some of the places that Dr. Dehlin just recited that are really straight from the CDC, straight from Michigan's government websites, because you're going to protect yourself from liability to the greatest extent you can by following the right science and the right guidelines. These are going to be judged as the gold standard for how businesses react with their employees and with their customers. The law is unsettled right now because it doesn't quite know how to deal with coronavirus. Unlike some of the prior pandemics we've dealt with, we have a scenario where this virus certainly manifests itself in people dying, but it also manifests itself in ways that you cannot see until it is spread. Because the law is unsettled, you will do well, based on the law's experience with past pandemics, to rely on really good medical and governmental guidance. That's just the way you're going to be judged. So what I'm going to do here is to go through the list of legal protections that are afforded your employees. And as I go through this list, I'm going to assume that you have already taken the health and safety measures for your workplace that have been recommended by the CDC and the state of Michigan. And I suspect that Ruth Solinski later on in our panel from the human resources side is probably going to talk further about those kinds of safety plans. But my talk really focuses on assuming you have taken those health and safety measures and you still have employees who are afraid to come back to work. What can you require? What legal protections are out there for your employees, and what do you need to follow? So whenever I get a call like this from an employer client, I start by working through my list, and I'm going to work through this list with you now. Next slide. So the first one is the most recent Families First Coronavirus Act. So if I've got an employee who is afraid to come back to work, and the employer needs that employee back, the first is to determine whether the Families First Coronavirus Act applies to that employer still, and whether the employee is asserting one of these reasons for potentially being qualified for paid leave or an expansion of family medical leave under this act. And those of you who have done some reading about this act already know that in general, what we're talking about is all businesses with fewer than 500 employees. And there are some exceptions for businesses under 50 employees, which gets into some details here. But essentially, most businesses are covered by this act, and it provides that up to 80 hours of paid sick leave is available for employees if they have one of these situations that causes them to be unable to come to work or even work from home because of these. There are these 6 reasons that would give somebody this ability. And there's also a family medical leave extension for the childcare reason, but we're not going to talk about that right now. What we're focused on is an employee who's afraid to come to work because they're going to, they think, get COVID-19. So these top 4 reasons are really related to either the employee's own health or symptoms they're experiencing, or the health and symptoms of somebody that they are caring for. So the first thing you want to try and rule out is, well, is the employee in one of these situations where they might be entitled to paid leave? So you want to try to suss that out. And everything I'm going to be talking about here, by the way you work through your list is not to just, to the extent you can help it, take verbally what your employee is telling you, to try to ask them for some kind of documentation, some kind of proof as to where their information comes from, whether it's their own health symptoms that they're experiencing or whether it's a diagnosis of somebody close to them. Try to get some medical information, preferably on paper. And the Families First Coronavirus Act, this is the one that was passed on an emergency basis, is very non-specific in terms of the kind of proof employers get to receive in order to comply with this act. Essentially, it's going to be enough if your employee called up their general care provider and described symptoms, and the provider said, yeah, you better stay home for 14 weeks. That is generally what we're seeing right now. So that's mostly the best you're going to get. But if you get a reluctant or afraid employee, you have to, at the very least, ask them to provide you with some significant medical information to advise you as to why it is that they're claiming this. Next slide, please. Next, please. Okay, next, if you have worked through the Families First Coronavirus Act and the employee is afraid, has not, though, given you much evidence or information about qualifying on those first 4 reasons, next you're turning to the Americans with Disabilities Act. And as an employer, you probably are familiar with this one even during non-pandemic times. This is a law that's been around for a long time. It's pretty settled in its application, and it essentially says that if you have an employee who has a disability and they are working for you, as long as they can perform one of the essential functions of the job with or without accommodation, you are most likely required to give them an accommodation to allow them to work with their disability. And the question is, what is a disability? Well, under the Act, it's a physical or mental impairment that substantially limits one or more major life activities. One of the questions I have is, well, is an employee's fear, if it's based in their own health condition, could that be deemed a disability where keeping an employee outside of work might possibly be an accommodation? First, you have to look at what kind of physical condition the employee might already be in. What are they telling you? Are they of the sort of folk who might already be at high risk for complications if they're exposed to this virus? A lot of the folks who are potentially considered disabled and need an accommodation are those who are vulnerable, like they have heart disease, diabetes, they have some sort of respiratory illness like lung disease or asthma. Some of them might be recovering from cancer treatments, who have a weakened immune system, kidney disease, etc. These folks tend to be, under the science, considered at higher risk for developing serious complications. So if you have an employee who is afraid to return to work, could it be that they have an underlying condition that makes them more vulnerable? If so, then they probably are going to be considered to be disabled and probably are going to be entitled to have a conversation about accommodation. What about the employee who is either had the virus and is getting over it, or has the virus and has lingering complications? Well, in general, under the ADA, a virus from which somebody recovers is not considered a disability because it's not something that lingers long enough to substantially limit their life activities. So generally, having the virus and getting over it, that does not make somebody who's had it disabled. Having the virus with lingering complications, maybe they're disabled. Maybe that would require an accommodation. As ever, do your best to get medical documentation, and employers are allowed to ask questions as long as those are job related and consistent with business necessity. I think under this circumstance, they probably always are going to be. If you're wondering about what kinds of accommodations might be available for somebody who either has an underlying condition and might need to be accommodated, or maybe has complications from the virus, I've listed a website on this page that is my go-to anytime I need to look at ADA accommodations, and that is a website run by the US Department of Labor called Ask Jan. So there's the link right there, and I would encourage you to look at it if you're in that scenario. Next slide, please. All right, so if you've worked your way through the FFCRA and you've worked your way through the ADA and you've still got an employee who is afraid to come to work and they've not produced the medical information that you've asked for under those acts and they don't seem to apply, you're not done yet. Now you have to look at the governor's executive orders. Remember, there's this one, the governor's order number 36. That one, the governor specifically prohibited discharge, discipline, or retaliation against an employee for staying home if one of these is true. Either the employee tests positive for COVID-19 or displays one or more symptoms, or has had close contact with a person who tests positive or displays symptoms. The close contact is defined in the executive order. Basically, you've been in a prolonged position with somebody and less than 6 feet apart. Certainly if someone is living under the same roof with you, but also if you've been sitting in a doctor's waiting room close to somebody who tests positive. In this case, there is no private right of action under the executive order. So what that means is the employee cannot directly sue you or make a claim for violating the governor's order, but they make a claim with the State Department of Labor, and that the Department of Labor would follow up on it. Further, the executive order goes on to say that an employer is not to discharge, discipline, or retaliate against an employee who fails to document that the employee or their close contact has COVID-19 symptoms. This is a tough one for employers because, as I have already said, it helps to get that medical verification of why an employee is afraid and not coming back to work. And here we have an executive order that says an employer's can't do anything if the employee fails to document that. It's a tough one. My best advice to clients is to do the best you can to try to verify what the employee is claiming and try to get them to give you something medical, even if it is just a message exchange that they had with a nurse practitioner over the phone. So because there's no private right of action with this one and it relies on the employee filing a claim with the Department of Labor, I'm less worried about that than the other two laws, but still do your best to get some medical verification if you've just got a fearful employee. Next slide, please. The other executive order we have to look at, of course, is the expansion of unemployment benefits. We talked about this during a prior LSCP webinar, but you all are aware of the governor's executive orders expanding unemployment benefits. Chiefly, employees are deemed to have left work involuntarily for medical reasons and therefore qualify for unemployment if they are self-quarantining for any one of these reasons. So if you have a fearful employee who is saying, no, I can't come back to work, you want to have them describe why it is that they feel they need to self-quarantine, and again, try to press them for some shred of medical information that they have that causes them to feel they need to self-quarantine. And this matters because, of course, if they are not working for you, you are most likely to get an unemployment claim that you as the employer will then have to verify and determine whether you're going to go along with it or whether you're going to protest it. So it helps on the front end if you can get that medical information from them. Note this unemployment qualification doesn't apply if the employee is already on sick or disability leave before the executive order came into play. Next slide, please. So what if you work through this list of laws, the employee's not really coming up with any credible medical evidence, and you suspect the employee is just fearful and or just doesn't want to work? Well, the last part of the process is to try to get the employee to name specifics, communicate with them. And what I mean by that is to try to get them to describe why it is that they're afraid and what it is that they're afraid of. Now remember, if you have done your job as an employer, you started out by making sure your workplace complied with CDC recommendations and state recommendations to make it as safe as you can for your employees by taking some of the measures that will be described elsewhere in this webinar. So when you have this conversation with the employee, try to drill down to what it is they're afraid of, and hopefully you can allay some of their fears by describing the precautions you've taken and emphasizing that you've done what the standard is. Sometimes, for example, you will find out that the reason why the employee is afraid doesn't have much logical basis. They've just been watching or reading too many sensationalistic articles, or they're afraid because they're potentially going to have contact with a relative in another state who's immunocompromised. I mean, those are some of the attenuated relationship discussions that I'm having with some employers and their employees. I mean, it's a little less logical to talk about being afraid to go to work if you might possibly have contact with an immunocompromised relative in another state versus employees who are on the front lines caring for sick people. I mean, it's a little hard for an employee to make a viable legal claim saying that they were too afraid to go to work and they're justified in making a claim if they have that more attenuated fact situation as opposed to somebody who's on the front lines working with sick people. Consider whether a short period of additional unpaid leave will resolve it. Sometimes that's enough to get employees to come back to work. And then, of course, document your efforts to get employees to come back to work. This is how, again, you will be judged in hindsight further as the law goes on. If an employee makes a claim or files a suit, you want to be able to put forth documentation showing your efforts to demonstrate to the employee that you were doing your diligence in keeping safe. Demonstrate your efforts to bring the employee back to work and give the employee benefit of the doubt to try to drill down to why they're afraid and try to allay their fears. Employer knee-jerk reactions to just fire people on the spot. These are things that are not going to help you during this time. It will help you if you actually try to communicate with the employee, try to allay their fears, try to do what you can to work with them. If you get to a point, though, where you have done all these things and you just need to know whether this employee is going to come back to work or not, then you're doing a final recall letter. And on the next slide, I have given you an example of what that might look like. Next slide, please. So this sample letter that I put together is something that essentially says, in writing to the employee, look, here's what we've done. We've offered you your job back. Here's what we expect of you. And we are recalling you to work. And if you do not show up for work by this date, we will consider this a voluntary quit. We will treat this as job abandonment. And that's the end of the line. And why do you do this? Well, this is part of your ongoing documentation effort to show that you worked with the employee to the best of your ability to inform them of the safety in your workplace, inform them of what kind of situation they would be facing back at work. And you are documenting the fact now that you have offered them work and you want them back. This, at the very least, will help you if you need to protest an unemployment claim later on down the road. Next slide. In closing, we do have some questions that I know are out there in terms of what does the law require or prohibit regarding testing of employees? Well, when we bring employees back to work, and Dr. Dehlin mentioned this, and I think we'll talk about this elsewhere in the webinar, there is the concept of, well, what if we take temperatures of employees? Because high temperature is a marker of potential infection. What if down the road there ends up being a reliable antibody test that is more easy to administer than the kinds of swabbing that Dr. Dehlin was describing? What if it's something that employers could do? Well, the first thing you should do is take a look at EEOC guidance, and I provided the link there on the website. Just last week, the EEOC gave more recent guidance on what is permitted under the ADA in terms of medical testing by an employer. Remember, the Americans with Disabilities prohibits general medical testing of employees under certain circumstances, and certainly it has to be job related and consistent with business necessity. This guidance from the EEOC essentially says that yes, employers can do testing for purposes of trying to create a safe workplace for COVID-19, but you still have to be mindful of the things under the ADA that did not change, which is you have to administer the test in a private manner so as to not violate the medical privacy of your employees. So you're not going to line everybody up in a line 6 feet apart and, you know, have them each stick a thermometer under their tongue as they walk into work, because of course that shows everybody in that line who had a high temperature that day. That is not a discreet way to medically test somebody. So you have to keep it in a private way. Only people with a real business need to know would have this information. You don't broadcast it around the office. And of course, you have to keep confidentiality with any results of employees. That goes for information that an employee may have coronavirus or have a diagnosis in their household. You don't stand in the office and announce, hey, Bob has this disease or Bob's wife has this disease. You instead ask Bob who he had contact with in the office and discreetly pull them aside and manage it that way. So the long and the short of it is testing is allowed under the EEOC's most recent guidance under the ADA, but we still have to follow protocols for medical privacy and confidentiality. And that's the conclusion of my talk. Thank you.
Thank you, Laura. Again, great information. This is a new territory for many employers, especially small business owners, and it's important for them to know the proper steps to take with reluctant employees. Next, I'd like to welcome Ruth Solinski. Ruth Solinski is a respected human resources and business thought leader and demonstrated results in building and sustaining labor and employee relations, aligning teams with business strategies, coaching and mentoring for performance and organizational development. With strong business insight, effective communication skills, and strength as outcomes-oriented leader, Ruth serves as the manager of human resources with RTI Surgical in Marquette. Also, as the owner and principal of Ruth Solinski Consulting, LLC, she provides consulting and facilitation services in the area of strategic planning, process improvement, and HR. She received her MPA with NMU and has a bachelor's in business and international management from the University of Texas at Dallas. Ruth will be touching on human resources and how to communicate with employees during this transition. Thanks for being here, Ruth. And Ruth, you have muted yourself, so you'll want to take yourself off mute because we can't hear. There you go.
Well, you just missed some really awesome comments. So thanks for having me, Mary. Thanks for the introduction. It's great to be here to talk about this challenging topic. Next slide, please. We know that returning employees to the workplace during and after the COVID-19 pandemic won't be as simple as announcing a reopening or a return to work date and carrying on as business as usual. That was highlighted in the excellent description by Dr. Dehlin of what we know, and even more importantly, what we don't know about the virus, and certainly the excellent review of legal parameters provided by Laura Reilly. Not only will we, as leaders in our workplaces, be altered initially, it's my belief that some changes may be long-term beyond the imagined finish line of a widely available vaccine or treatment. Businesses need a return to work plan that aligns with the needs of your business, your industry, and the unique makeup of your employees. I'll cover the key issues we all need to understand and prepare as we bring our teams back to work. Next slide. Employers have a responsibility, as you all know, to ensure that our respective workplaces are as safe as they possibly can be. Employees and customers alike may have fears that Laura touched on about simply returning to business as usual. Preparing for and communicating how safety is a top priority will help to calm fears and will serve to increase loyalty and retention among your staff. I've repeatedly encouraged our leaders that the choices we make during this process, the way we treat our people through this pandemic, will be reflected in the relationships that we have after this is long past. So some best practices from a safety standpoint and safety measures to consider for your business are to implement employee health screening procedures in line with the parameters that Laura laid out for us. That can be a questionnaire. In some cases, that can be more in depth, as she mentioned, but encouraging folks to know, are the people that are in our respective buildings healthy and safe to be there? I would encourage employers to think about updating and enhancing detailed cleaning procedures. One way to create calm and to assure safety is to make sure that we have systematic and routine cleaning of workstations and collective workspaces, and I'll go over more about that here in just a minute. We've talked about providing PPE where it's appropriate. That might be masks, as mentioned earlier by Dr. Dehlin. That could be gloves, that could be face shields. Certainly at a minimum, we're encouraging excellent hand hygiene and having the availability of hand sanitizer throughout our respective workspaces. During this time frame, we're looking to the CDC and others, and we know that where we can, it's appropriate for us to restrict business travel to make sure that only essential travel is being engaged in, and certainly respecting the stay-at-home orders of our respective states. Next slide, please. This is a sample of just some education around mask wearing that we put together for our employees. As mentioned earlier by Dr. Dehlin, face masks are a tool designed to prevent the spread of the disease. When someone coughs or sneezes, they release tiny droplets into the air around them. And masks require all, we have moved to a place where we require all people who are going to be on site, and that includes our employees, our subcontractors, and any visitors, to wear a mask. It's a precautionary measure, but there's little to lose, and it benefits all employees. And we verify as people are coming into the building that they have a mask. Next slide, please. Additional things to think about as we're considering workplace safety is developing an exposure response plan that addresses how you will isolate, contain, and engage in contact tracing in the event that you have exposure in your facility. The recommendation is that you actually have a space where if you have an employee that becomes symptomatic during the day, that you're able to isolate them if they're not able to exit the building immediately and safely. That may be a conference room that where they can be. That may be just a cordoned off area where an employee can isolate until they're able to secure transportation home. Your exposure plan should include stay-at-home requirements. So if you have a portion of your employees whose physical presence isn't required for them to execute on their role, consider work from home options. Exposure communications to the affected staff. If you have someone who is in your facility and exposed others, as Laura said, communicating to the affected staff in a way that protects the privacy rights of the employee that has been affected, as well as all of those to whom have been exposed. And then any plan that's developed should align with OSHA Regulation 29 CFR 1904. An additional consideration to support workplace safety is establishing physical distancing measures through staggered shifts, staggered lunches, staggered breaks, working from home or telecommute, as I mentioned, or actually physically moving workstations to maintain an appropriate distance. In our case, we have 6-foot tables in our break room, and so we've removed all but one chair at each of the tables to give a visual cue to social distancing, as well as to ensure that employees just don't naturally congregate. An additional recommendation as it relates to workplace safety is to establish really good hygiene protocols. I have an example of that on the next slide. I would encourage you to make hand hygiene part of what you talk about in your staff meetings, and that you create some communication materials that show employees best practice as it relates to workplace safety. So washing hands for at least 20 seconds, and that's equivalent to 2 rounds of happy birthday. And a good rule of thumb is to wash your hands every hour, and if not available to, use alcohol-based hand sanitizer in between. Our recommendation is that just like any other PPE, is that you have hand sanitizer in good quantities in all locations around your facilities. And then, as Dr. Dehlin said earlier, we do need to change our thinking as it relates to coming to work sick, reducing the stigma to take the time that we need to either work from home or stay at home when we're symptomatic. Next slide, please. So let's presume that we're getting to a place where we think the virus is lifted and where it's time to bring employees back to work. We want to do that in a way that is safe and supportive, but it requires a plan. All employees returning on the same day at the same time would be overwhelming and possibly unsafe, depending on the work environment. So some things to consider in bringing your staff back. Phasing in employees returning to work. And do that using non-discrimination factors for selecting who is able to return. You may choose as an employer, based on your revenues or in an effort to support social distancing, to implement a reduced schedule to start. so bringing some employees back on a less than full-time basis. And then scheduling employees to support employee safety as well as business needs. We encourage you to create a plan for employees in high-risk categories, as Laura laid out so cogently. Work from home and telecommute options should be available if at all possible. And then again, as we talked about, increasing protection measures if on site, isolating workstations, reducing people density, and having appropriate PPE. An example of that is on the next slide. In our facility, we staggered shifts in manufacture to include a compressed work week, deferred starts, and weekend shifts. We put limitations on people per conference room, and that's signs on the doors in each of our conference rooms show the max number of allowed. So in a particular conference room, if six people is the maximum, a seventh person is not allowed to come in. Same limitations that I mentioned earlier on a break room and any other common areas, using visual cues to show people what 6 feet of distance looks like, and continuing to work from home when possible. We've assigned the responsibility to sanitizing the conference room to the meeting organizer. So if I call an in-person meeting, at the end of the meeting, it's my responsibility to ensure that the tables and the backs of all chairs are sanitized with sanitizing wipes, and that hand sanitizer is available throughout the session. Next slide, please. In thinking about returning to work and bringing staff back, it's best practice to have a plan for handling employees who are unable or unwilling to return to work. And this aligns with what Laura said as well. You may have employees who are fearful, who have family obligations, and who remain under quarantine. And I think the advice that she provided earlier in this webinar is great guidance for all of us. A reminder to notify the State Unemployment Office of employees who have returned to work who refuse to return in line with the procedures that we talked about earlier. Next slide, please. Based on CDC guidelines, this is our recommendation for communications with employers in the event that that we believe there was exposure. We're asking all employees to self-monitor. So if you or someone in your home might have been exposed, watch for those symptoms that Dr. Dehlin outlined. We encourage you to continue to engage in good social distance. If you believe that you've had close contact with COVID-19, we're encouraging employees to stay home and quarantine for 14 days. That being said, the CDC is re-establishing guidelines almost daily. And so as an employer, we're staying in good connection with the CDC to ensure that we can update our expectations for employees. And obviously, if you've been diagnosed, we're asking you to self-isolate and encourage you to stay in a specific sick room in your home and away from others. And this is education that we're providing to all of our employees so that we can level set our expectations. Next slide, please. At the end of the day, our goal is to come out on the other side of this with a workforce that believes that they've been cared for and that are still engaged with us as an organization. Establishing a clear communication plan will allow employees and customers to understand how the organization plans to reopen or reestablish business processes. Some of what we learned from some of the organizations in the United States that have not managed this well, and I'm thinking specifically of the Smithfield plant in South Dakota, what we saw with the leadership team there was that they were not transparent, they weren't proactive, and they ignored the readily available clinical information that would have kept their employees safe. And so my encouragement to you is to push yourself to be transparent, be proactive with your staff, and make communication personal to your team. We certainly feel like we're building an airplane while we're flying it, so I know that this is a challenge, but communication will be the key to staying engaged with your employees. Some considerations. We encourage you to draw firm linkages to staying home if you're sick and physical distancing to the safety of your employees, their families, customers, and our communities. We believe now is the time for us to be a good steward for all of those constituencies, our employees, their families, our customers, and our communities. Outline in detail any new workplace safety and disinfection protocols that you put in place in response to the pandemic. This will help to give your employees a sense of calm. Share information on your exposure response plan. Employees are encouraged if they know that you have a plan in place and you're ready to execute on your plan. Internal and, if appropriate, external communication should be ready to go with return to work timelines, safety protections, and exposure response. And again, as clear and transparent, proactive, and personal as you can make your communications, you'll be more successful in re-engaging your workforce in a meaningful way. Next slide, please. At the end of the day, we're all in this together. We are responsible for each other's safety. Our encouragement to our teams and our encouragement to you is that we work to keep our work areas clean and do our part to prevent the spread of the virus. Remind each other when we forget simple things like our masks, and at the end of the day, be kind. Our actions outside of work and in the plant can impact our loved ones and those of your coworkers. And again, the way we take care of our employees through the pandemic is the relationship we'll have with them when they're done.
Thank you, Ruth. Great information coming from the HR side. I think one of the most important things to take away is that business owners need to do everything that they can to make their employees and customers feel safe. So appreciate the great suggestions on how to do that. Next, we welcome our last panelist, John Bennett. John is the owner and creative director at Bennett Media Group. John graduated from NMU with a degree in graphic communications and has 8+ years of experience in cable advertising. Bennett Media Group was established in 2014 and the business first opened in the corner of his wife's wellness studio. John says his education, work experience, and passion for creativity and business led him to where he is today. Now located in downtown Marquette, their team has since grown to 7 members and is able to provide 50+ regional clients with full service marketing. Here to speak on marketing and promotion during the restart. Thank you for being here, John.
Thank you, and good morning to everybody. So thanks for having me, and thanks to the LSCP for putting these webinars together. I think they're, I know for myself, they're very beneficial. So hopefully we can continue providing value today and talking about getting your business back on track as we, face this downturn and hopefully inch towards the new norm in business. So some cases, like I said, we're revamping things in some businesses, and some of you might be starting right from scratch. So now is actually a good time. So next slide, I'm sorry. As Emily said, we're a 6-year-old company and we're a team of 7. So as a full service agency, what that means is we have our creative services in-house with, a little bit of expertise in each area of marketing, from digital to traditional, and creating messages that our clients tailored to their customers' demographics and target audiences. So we'll be talking about that a little bit today as well. Next slide. So, we're obviously presented with a unique challenge as businesses and business owners. The effects of the virus are obviously unprecedented and something we've, at least myself and many young businesses, haven't seen before. Our first responsibilities have been the safety and well-being of our staff and our customers, and I think we've all done a good job with that. But now we must turn our responsibilities into making financially responsible decisions in our businesses and looking to the long term to move forward. So, what I'm going to talk about today is meant to help your brand stay stable during these times and, really prepare for what will probably be the long-term effects of this virus and what that looks like going forward. So we're going to be promoting, agility and long-term strategic planning or long-term view with primarily a focus today on social media. Next slide. So our main focus, how do we market during this economic downturn and prepare to get back to business? The actions and mindsets, of our consumers have changed, and it's become more important than ever to carry out our messaging and branding with strategy and consistency. So yes, we want business to grow, and that's the objective, but more importantly right now is really to steer our business back to a somewhat state of normalcy. So, we'll talk about identifying those changes in consumer habits. Where does your brand or your business fit? We'll talk about strength in branding, strategy on social media in particular, and that strategy can carry across other platforms as well. What's worked in the past in somewhat similar situations, and we're entering a new era. So what does that look like? Next, please. So first, we must identify the changes in our customers' habits. And as these things keep changing daily, so do their wants, needs, and spending habits, and we need to be recognizing that. As many of you know, efficient marketing effort starts with identifying your target market. Typically, the first steps are looking at your core market area. This could be the Upper Peninsula, Marquette County, or maybe it's a 15-mile radius around your location. Then we'll look at things such as customer demographics, interest behaviors, such as age, gender, income levels. Do they own or rent a home? Do they have kids in the home? Are they interested in classic cars, home renovations, or eating organic? These are all ways we target our customers, and we have been. These are still important. We also now have to factor in that these economic times have a great effect on our customers' spending. So remember, when revenue is growing in a stable market, it's not just because you have a quality product or service or that you have an effective marketing strategy. It's also because our customers have disposable income. And right now, for many of those people, that income doesn't exist, or it's less, or we're in a scared state where we, are saving our money and not spending it. So we can actually now break these consumers into 4 separate categories. The first is the saver, or the slam on the brakes. No matter what the income bracket, they're cutting back across the board. These people are scared. They don't really see the light at the end of the tunnel yet, and they're only buying the essentials and downgrading those when possible even. The next is the wait and see customer. This is the mainstream. They see the horizon in the distance, but are acting prudent. They're looking for deals right now, but not much more than that. Next is the comfortably well off. These people don't have much care in the world right now as far as saving money. They're living for the experience and the affordable things. They're not changing their behaviors as much, just being slightly more selective in their purchases. And this is as long as they are either employed or have steady income. So some of these people may be retired and have done well for themselves and have a little bit more disposable income, or maybe they're still working as normal and they haven't been phased income-wise. The fourth category is the unfazed, or the live for today consumer. They're not phased by this. They're secure enough to ride it out. They're either at the top of the income bracket or living below their means, being financial savvy. So they're kind of a glass is always half full type of person, and trying to seek a positive in every situation. Next slide. So we need to ask ourselves, where does our business fit into this new breed of consumer? And some of those things is your brand or your product a must-have product that your core customer needs or wants today? Is your product a want and something that they can hold off and buy later? Or maybe is your product an impulse buy? So think about these things when you're looking at your core customers along with those changed consumer habits. So how can we serve these customers differently? And that's, we're adapting here, and a lot of businesses have done a great job of that. Look at the restaurant industry right now. Many restaurants were dine-in only. They didn't deliver. They didn't offer curbside pickup, and now many of those are, and it's keeping them alive at the minimum. So they're adapting and they're doing what they can and doing things differently to serve their customers. Other examples are car dealerships. You know, we can't go to the showroom and buy a car right now, but we can online. And you know, one of our clients right now, they're delivering cars out of their premises. They're meeting people in a parking lot at Target to hand the keys over because everything else is done online. So people are adapting, and we need to think about that in our business, and how can we offer things differently or do things differently that we haven't traditionally done. Next slide. So once you determine how your customers' purchasing habits have changed, as well as identified kind of where your brand fits within this new norm, you can now think about how you're going to talk to them. Think about your messaging. So rely on the strength of your brand. You know, your brand is something in most cases. I mean, this is a cornerstone of your business. I mean, you thought about this when you first wrote your business plan, and you know, whether you're conscientious or not, but you build your brand the entire way. So maintain your authenticity by being empathetic and understanding, and be real. People want to see the real you, especially in small business. So be authentic. You know, another idea is look to inspire your audience by doing things differently with your products or services. Create a community around your brand. Always staying positive and, you know, kind of piggybacking off each other, relying on each other is always a good thing. And finally, be flexible. Share your solutions and ideas, and this can help ease any fear of purchasing. And we talked about the delivery and doorside pickup. I mean, people are reluctant to go into places and you know, go to public places and touch doorknobs and be amongst people. So share your solutions and how to overcome that fear. Payment plans could be part of this, or online pickups, that sort of thing. So, I mean, Menards is the same thing. They're open and you can go in there. And I had to make some purchases myself at Menards, but really didn't want to go in the store. So I simply ordered it online. And they have an option to deliver right to my house, or I can drive right around back in the lumberyard and pick it up. So be flexible in that regard. Next slide. So once we know more about the current state and the buying habits, and talk about our brand, our messaging, how and where can we reach these people? You know, most of us are working from home, or laid off, or at home. This gives us a lot of time to consume content across a lot of different platforms. Even those who are still working are spending more time, you know, consuming news and staying up to date on current situations online. So, and there's value to every platform at this time, but most efficient way to genuinely communicate with your customers right now is going to be social media. Social media consumption itself is up 70% since early March. Engagements on social are up 60%. So not only are people on social media more and they're scrolling, they're actually interacting. They have the time to comment, talk, communicate via social media. So this is actually an opportunity for businesses to, you know, have conversations almost with clients and potential customers through social media. So in a time where many of us are experiencing cuts in our marketing budgets are minimal, if not zero, a lot of this opportunity on social takes little to no money to get started, and the only thing you're going to sacrifice is your time and a little bit of brain power. So in this time in which we are in, this is probably your best or lowest hanging fruit to start to communicate with your audience. But we need to be smart about it. So it's likely you're not, I mean, this isn't meant to say, okay, we're opening our doors, you know, tomorrow, I'm going to be on social media in the next 5 days, customers are going to return to more normal. That's not the case. But what we are doing is we're building for the future. So keep us in mind, especially over the next 2, 3, 4 weeks, or whenever the stay-at-home order is lifted and we inch towards the new norm. So, you know, in addition to the opportunity we have, these platforms are very measurable. So we can track and measure, are people engaging with our content, are they responding based on the objectives we set forth. So that is another huge opportunity we have as businesses to during this time is to kind of figure out what's working. So when we do get back to normal or inch towards that norm, we know where to start, right? So, so what's the strategy? And I think we have a common ground in my messaging today, but it's first to be real and authentic and be personable in your social media posting and your content creation. So, people don't want to be sold to. Facebook and social media isn't meant for that. A couple years ago, Facebook made some major changes where businesses, it was a big challenge to get your message out there, even on an organic level, because Facebook is meant for intimate conversations amongst people. So we want to present that as we're putting our messages out there as businesses as well. People want to be understood. They want to feel like they really matter. So customers will be more likely to stop on a post that feels real versus a sales pitch. And I think that's pretty obvious, but I also think as business owners and people in business, sometimes we lose sight of that. So keep that in mind. Write your posts as you would speak to a customer on the street or to a friend on the street outside of your doors. Does it sound like an ad or does it sound like you? Think about that when you're posting. People love to see your personality, and the more they can see this and feel this, the more likely they're going to spend time looking for your content, reading your content, viewing your video content, exploring your business and what it has to offer. This will soon turn into trust. And when you have a consumer's trust, you're going to earn their business in the future. So with that said, we also need to focus on how to serve. And before posting anything on social media, I invite you to ask yourselves the following questions to be sure your post fits. How is this adding value to my audience? Okay. How is this relevant to my audience's needs, thoughts, or feelings? And can my audience relate to this? So those three questions, if your post fits one of those, you're heading down the right path, okay? We don't want to just pitch. We want to give before we pitch. They say a customer needs to see you or your product or your service, 7, 8, 9 times before they're going to make a purchase on it. What we're trying to do here is build up your brand before even having to make a pitch of a product or service. So we're all small businesses in the most part, so people like to see who's behind the counter, or who's the one with the name on the door, and there's value to that. So be consistent in this. With any marketing, frequency is extremely important. Okay, there's not necessarily a magic number. I get this question a lot, like how many times should I post on Facebook for my business in a week? How many times shouldn't I? That's something you can figure out as you analyze what's working. I will say this, posting multiple times a week using creative content such as video or photos will help in gaining that attention. I think, every business is different, but if you can get to a point where you're posting once a day for your business, that's excellent. Just make sure as you're posting that what you are posting is unique, and it is relatable to your customers, okay? So, we all have smartphones, right? We all have the capabilities of photography and videography, from anywhere we are. So content in this day and age, it doesn't have to be 100% polished and professional looking when you're talking about organic posting on social media. So utilize your cameras. I mean, not all videos of myself are pretty, I'll tell you that right now, but at some point in time, you got to get your face out there and let people know who you are. And doing that through video is a way to, be as authentic as possible. People see who you are, how you talk, your mannerisms, that sort of thing. So there's a great power in video on social media. So getting into a digital strategy, and we've worked towards, our organic content, building our brand, building trust with our customers. Digital strategy is a great addition or complement to what you've done and are doing on social media. Now, digital is an enormous umbrella, and that word encompasses a lot. But there are some ways you can help your social strategy with some minimal to $0 investments through digital approaches. One would be optimizing your website. Go through your website, make sure that the keywords in your website are relevant and updated to what your business has to offer, who you are, what your brand is. Another great idea, create a blog or a vlog. And I know a lot of people do this already, but it's huge value in blogs and vlogs. This is content that you can use both on social and on your website. These blogs and vlogs, pack them with your keywords, and they're going to so at this point, implementing some of these things and being consistent, knowing your target audience, you probably have a pretty good, over the next course of 2, 3, 4 weeks, you have a good feeling about what you're doing organically. So this is where you can start thinking about getting back to investing into advertising itself. Now, every business objective is unique, different. Even two banks that offer similar mortgage rates, auto loan rates, HELOCs, their objectives are different. So there's no real template or designed way to get a guaranteed success in marketing. However, some of the most effective and cost-efficient digital platforms are going to be your social media paid campaigns, some Google ad campaigns, and then you can get into things like pre-roll video, streaming video, banner ads, email marketing, so on and so forth. Another question I get a lot, especially with new clients, is, well, what should my budget be? Well, there's, again, no real answer to that. I don't know all the ins and outs of your business. Start with a typical 3 to 5% of your gross and work from there is usually what, we say. We can help, or anybody can help, but you got to think about what your core demo is and what your objective is in regards to your marketing dollars, and that will help kind of facilitate what kind of budget you're looking at. So with all that being said, whether it's organic, paid, or a combination, it is super important to continually measure and adjust accordingly. We're in our clients' digital campaigns daily over here at our office. Things change, is the message working with the audience that we're targeting? Those kinds of things. What's the view rate of the video? Why is it lower than what we expected? So you got to continually monitor and measure, and that's going to make your dollar go further in marketing. Next slide, please. So obviously there's an unprecedented situation, and there's not much to compare it to, but we all are familiar with the recession we faced in 2008. And this is just a little study that was put together by Elite Marketing, that during the mortgage crisis, of the brands that were forced to make cuts, those who actually grew market share following the recession were found to have increased marketing, research development, and product development during the recession. So again, this isn't a solution today, but those who grow and grow faster coming out of a downturn are usually investing in those three parts of their business during that downturn. Next slide. So to kind of wrap up, we're kind of in a new era here, and I know this is somewhat obvious, but these things can spark new ways or new ideas for you to relate to your customer. Digital, this is the new norm, right? We're working from home, we're online, we do Zoom meetings, GoToMeetings. Everything is digital right now. So I mean, you can even, as Dr. Dehlin said, you can talk to your doctor over the phone. So we're constantly on a screen of some sort. And don't get me wrong, prior to this we were too, but now it's even exponentially greater. So how will your customer experience change with this new norm? What are our opportunities? Delivery, is this a new expectation? Essentials have been delivered to us, right? A trip to the store went from hassle to hazard. What will customers demand of delivery if your product or service fits? The collective well-being, this is a top priority right now and probably will be for the foreseeable future. Especially not just for ourselves, but for our customers, our staff, our employees, and in particular seniors and the older population. So how will we, adapt with this? And then finally, local pride. I mean, we're a small community. We have a lot of pride in our businesses. You know, a lot of our favorite gathering spots or local restaurants, they've been hit hard. So the more we can support and rally as a community, as businesses, the better off we're all going to be. We're all in this together. And how can your brand lend support, especially with social media? Always tagging and mentioning local businesses is going to have some return to you from a branding standpoint in the future. So next slide. So in summary, you know, we're working to build our brand through this time and build trust. And that's kind of, in my opinion, should be our focus. When we have that awareness and trust and the time comes to open our doors and start, you know, selling product and services, we'll be that much further ahead. So try to understand your consumer habits and how they've changed, and how can we relate to that audience specifically. You know, with all these efforts socially and digitally and even other mediums such as TV, we can still target, right? So the better we can put that message, or the more accurately we can put that message in front of the right audience, the better off we're going to be. And continue to be true to yourself, be true to your brand, be you. Don't change from that. That's what people want to see. Consistency is a big part of this as well. Don't stop. I mean, it takes a lot of time, it takes a lot of effort to come up with ideas and posts and put them out on social media, but it'll be worth it in the long run. And finally, stay positive, stay optimistic. Like I said, we're all in this together, but we'll get through it. It's just going to take a little bit of time. So I'll leave you guys with a few interesting facts and stats, and I won't go through all these on the next slide. Something interesting to me is in regards to social media, videos are shared 1,200% more than text or links combined. So think about that. And that, you know, video is a powerful medium. It's very influential. So if I could steer each and every one of you to do more videos, please do, because it will benefit you in the long run. But I won't go through all these stats. I'll let you guys have that. And that wraps just about everything up. Time to take action is now, though. I wouldn't wait. And if you've been doing this already, you're off to a great start. Continue with it. Keep it up. There's a quote, Henry Ford, a man who stops advertising to save money is like a man who stops a clock to save time. So keep your foot on the gas, and thank you.
Thanks, John. Really helpful information for businesses to take advantage of. Marketing is going to be key for them to focus on with the reopening. So I know that we are going to be going over a little bit with our time, and some panelists might have to go, but we do have a few questions. So if some of you can hang around, that would be great. Laura or Ruth, this one would be directed towards you, and this has got multiple questions in it. So as an employer, are you required to provide a mask? Whether, if you're required, does the staff have to wear them? Do you have to be within the 6 feet distance to cubicle walls or tall desk cabinet work for blocking the workers? If you're having meetings in a boardroom, do you have to maintain that 6 feet distance? And if you're not meeting all of the requirements, can your employers report you to OSHA as a violation?
Well, I can talk about the legal requirements, and then maybe Ruth, you want to tag team on this a little bit. But in general, the first thing I would look to is the governor's existing executive orders, because those are the things that tend to change most frequently. And again, we're all going to be judged after this by the extent to which we followed existing guidance and existing law. So look to Executive Order 59. That's her updated stay home, stay safe order. And in a section of that order, she describes, for businesses whose in-person work is permitted, the following measures must be taken. And that's 6 foot distancing, limiting in-person interaction, and providing PPE, such as gloves and face masks are certainly part of this. The order specifically says providing it is the job of the business for employees. Now, I would tend to think it makes sense to not only provide the masks, but also require them to be worn by those who can. but the executive order at minimum says that the employer or the business should provide the mask for its employees. Whether cubicle walls count, I would refer us all to Dr. Dehlin's discussion at the top of this webinar. The virus primarily spreads through droplets coming out of people's mouths and noses. So cubicle walls, I suppose if they're tall enough, but I can tell you in our office, we're looking to not have the cubicle be the only separation. We're looking for more than that. Further, blocking, different obstacles blocking like desk cabinets or things like that. Again, are they going to be able to keep out droplets from sneezes and coughs? I would rather have both a barrier and a mask if I'm the employer and trying to keep my business as safe as possible.
Thank you. Dr. Dehlin, this question is for you. What are your recommendations for workers in small gift shops when tourist season is about to start with space so limited as it is? We have difficult time getting people to read anything posted, and it's overwhelming to know I will soon be exposed to a constant stream of people from any area and in a very tiny space.
Back to some of the principles that all of us have gone over in our presentations. First, trying to have that shop provide their service in a way that doesn't require any face-to-face interaction at all, like curbside or home delivery. Second would be requiring that so keeping the employee physically separated from the customers by using something like the sneeze guards and the appropriate mask, goggles, gloves, designing the space in the shop so that you don't have to have a close physical interaction. So, you know, maybe the card reader for the square is 6 feet away from the employee, and the shopper puts their card in, takes their card out, and is on their way and never comes within 6 feet of the employee. Some of those small shops, you might just need to physically have somebody limiting how many people come into the shop. So that some come in and some come out. I know something like that's been done in like the Seattle farmers market. They basically have a bouncer so that too many people don't come in the store. But I agree that signage is difficult because people don't stop and read it.
Ruth, our next listener, is looking for guidance on how and what to ask employees about their ability and or willingness to return to work. Can we survey? Can we ask general questions about why they don't think they can return using the broad reasons for coverage under the FFCRA? Also, does the FFCRA pertain to all size employers? How do small offices manage this? I think Ruth might have had to jump. Oh, nope, she's there. Ruth?
Can you hear me?
Yep, can hear you now.
Can you hear me? Okay, perfect. Yeah, in general, we can ask employees to assess themselves. Again, within the parameters that Laura laid out earlier, we need to be careful about pre-existing conditions that might be subject to the ADA. And then any request for information has to be treated within the appropriate confidentiality protocol. What was the rest of the question?
Let's see. Can we survey? Can we ask general questions? How does it pertain to all size employers, and how do small offices manage?
Yeah, well, as noted earlier, there are things within the federal statute that apply to employers that are 500 employees and less. But you also have to bear in mind, as Laura outlined, the things that are embedded within the governor's order as well. So unfortunately, there's not one place to go to get the sum total of the guidance. That being said, again, with a small office, I think you can follow some of the protocols that we've talked about here today, asking people to self-report, trying to get as much information documented as you can to be able to respond appropriately to an employee's individual situation. Anything else that you would add, Laura?
I would say because at this time there are some different executive orders and different federal guidelines to follow, that this might be a good time if an employer is faced with an individual situation where they're not really sure what to do. This is a good time to gather up your team of professionals, call your lawyer, and understand what the law requires and doesn't require, because at this time, that's a lot of what the questions that I'm getting is employers trying to integrate the executive orders, the federal orders, what all works together to require my actions here.
Great, thank you both. John, this question is for you. If we only have time to focus on one social media and do it well, what would you recommend?
That's a good question. I mean, I guess it would depend on type of business and what your core demo looks like. But right now, Facebook is probably, from a B2C standpoint, you're going to be your best bet. If you're a business to business, LinkedIn is something I would consider as well. But Facebook, has over 2 billion users in the world. Instagram is owned by Facebook. There's, close to 900 million users on Instagram. Your demographics are different a little bit on each of those platforms, where Instagram's a little bit younger, but Facebook, you have a little bit more option, I think, in regards to targeting and, tailoring your message to your audience.
Perfect. And one more question, and this can be to anybody. If someone is afraid to come to work and you allow them to work remotely, how do you keep others coming to work? Can you favor one over the other?
That's a great question. I wouldn't do that without some solid evidence as to why you're doing it. Because I would be concerned about discriminatory treatment. If there is a solid medical reason why somebody has to stay home and cannot have contact with others versus not, that's where you're really going to be doing your best to get some kind of medical guidance that you can rely on as the fact basis for why you're treating others differently. So essentially, you just want to be clear that you have a solid factual reason, either medically or for a pure business purpose, as to why one person is treated differently than others.
Great. Well, thank you, Amy, Dr. Dehlin, Laura, and Ruth, for everyone who attended today's webinar. If you have any other questions, please contact the LSCP. You will also receive a follow-up email within 24 to 48 hours with the presentation slides and a link to view a recording of today's webinar. The webinar will also be available on our website, marquette.org. On behalf of the LSCP and our panelists, thank you for joining us today, and enjoy the rest of your afternoon. And thank you, John. Sorry I missed you on there, but thank you so much.